From the end of World War II until the present day, Japan's economic growth has led to many changes in Japanese lifestyle. During this period, the health issues faced by Japanese society have also changed significantly. Japanese nutrition policy has also changed and evolved up to the present day, adapting its focus and methods to the social needs of the time. This presentation aims to help you understand the relationship between historical challenges and the efforts undertaken in Japanese nutrition policy at various points in history. This relationship may also provide some insight towards policy actions in your own country. In this presentation, we will look at Japanese nutrition policy and its historical evolution from 5 different perspectives. Over the last 100 years, Japan has experienced a surprising transition in prevalent disease trends. Before World War II, half of Japanese deaths were due to infectious diseases. Tuberculosis was particularly prevalent, causing 1 out of every 10 deaths during this period. However, after the war ended, lifestyle-related diseases such as stroke, heart disease, and cancer began to increase rapidly as the main cause of death. This trend continues through to the present day. So what kind of nutritional policies and systems has Japan created to respond to this transition? Let's start by examining the nutritional challenges policymakers faced from the post-war period to the present. First, let's look at the historical issues from the end of the war in 1945 to the present day, and how these issues created challenges for Japanese nutrition policy. In 1945, when post-war Japan suffered from food shortages, responding to nutritional deficiencies was the first priority of nutrition policy. During this period, Japan received food assistance from the U.S. and international institutions. Following those hard times, Japan entered a period of high economic growth in the 20-year period from 1950 to 1970, and the Japanese population grew to exceed 100 million. As economic growth continued, changes in diet and lifestyle led to an increased prevalence of lifestyle-related diseases. Because of this, nutrition policy began to focus on improving people's dietary habits. From 1990, the average Japanese life expectancy increased further, and the concept of an 80-year lifespan became commonplace. By 2007, 1 out of every 5 Japanese citizens was 65 or older. Because of this, modern-day policy for extension of healthy life expectancy focuses mainly on health promotion, prevention of lifestyle-related diseases, and combating undernutrition and frailty of elderly citizens. Moving on, let's explain more thoroughly the history of nutritional policies in Japan. Nutrition policy in Japan has a long history. Even before World War II, as people in the Tohoku region suffered for many years due to famine and cold weather, dietitians were deployed to respond to the situation. Joint cooking was encouraged and became the basis of large group meals. In 1937, the Public Health Center Act was enacted, aimed at increasing citizens' overall vitality and providing health guidance in each region. This act included dietary improvement as an important responsibility of public health centers, and dietitians began working with local residents throughout Japan. In the period around World War II, the nutrition law system was created due to food shortages and nutritional deficiencies. As time passed, various systems for nutrition improvement were formulated. In 1945, the Ordinance on Dietitians was issued, formalizing the licensing requirements for dietitians in Japan. In light of the issues with food supply, development of dietitians became an urgent issue. In order to ensure unified guidance on national nutrition, the Dietitian Act was enacted in 1947. This act specifies dietitians' position and duties, and the licensing of dietitians was made a matter of law. While national nutrition levels had been somewhat improved due to many years of nutritional guidance, these results proved to be insufficient. Therefore, in order to further facilitate nutritional improvement programs, the Nutrition Improvement Act was enacted in 1952, aimed at maintaining and improving national health and vitality. This law established the following: a national nutritional survey to understand citizens' nutritional status, nutrition consultation offices at which citizens could seek nutritional guidance, deployment of nutrition counselors to work at these offices, nutritional management at large-scale shared dining facilities to help ensure the nutrition of certain groups, and introduction of an approval system for labeling special nutritious foods to help consumers make purchases with confidence. After the enactment of the Nutrition Improvement Act, the legal status and duties of dietitians began to be gradually established. This included the deployment of dietitians to hospitals under the Medical Service Act and the enactment of the School Lunch Act of 1954, among others. In 1962, the Dietitian Act was revised, and a system for licensing newly designated registered dietitians was created. In addition, the revision of the Nutrition Improvement Act led to more advanced nutritional guidance and the expanded deployment of dietitians and registered dietitians, particularly to facilities that require special nutritional guidance and food supply management. Over the course of Japan's nutrition policy, public nutrition activities were initiated in order to meet regional nutrition needs. In 1954, when clothing, food, and housing were in short supply, nutritional guidance cars with cooking equipment, called kitchen cars, were introduced. The cars traveled through towns and villages, including remote mountain regions, to hold lecture sessions and cooking demonstrations in order to provide every Japanese citizen with information on a nutritionally balanced diet. This program became extremely popular and attracted many people. Eventually, this program was taken over and administered on a prefectural level. In 1959, more specific regional efforts were deemed necessary to spread knowledge of a better diet. Nutrition classes were held with cooperation from public health centers, and people who completed these classes were assigned the role of local guides for health promotion. These volunteers were given the label of health mates. Going into the 1970s, there was a growing belief that each Japanese citizen should realize and internalize the concept of protecting one's own health. With this in mind, the first national health promotion measures began in 1978 as the top priority item in the Ministry of Health, Labor, and Welfare's budget. In accordance with this, the roles of registered dietitians and dietitians were shifted from services centered on food security to services focused on primary and secondary disease prevention. The objective of the first national health promotion measures was to simultaneously enable healthy citizens to lead even healthier lives and prevent the onset of disease for those with high blood pressure, obesity, and other such conditions, allowing all of Japan to attain a healthier lifestyle. From 1978, a 10-year plan was put in place based on 3 basic strategies. 1. Promoting a full lifetime of healthy living. 2. Establishing health promotion infrastructure. And 3. Increasing public awareness of healthy living. The second National Health Promotion Measures of 1988, through the Active 80 Health Plan, focused on the promotion of exercise habits. The third National Health Promotion Measures began in 2000. In order to better understand citizens' nutritional status, emphasis was placed on developing evidence-based programs based on results from the National Health and Nutrition Survey. From 2013, the fourth National Health Promotion Measures began. The fourth National Health Promotion Measures, which began in 2013, will continue until 2022. These measures set a 10-year goal of achieving a thriving society of healthy, fulfilled citizens committed to supporting one another. To achieve this goal, targets for nutrition and diet were set, including 1. An increased percentage of people who maintain healthy weight. 2. An increased percentage of people who eat a healthy amount and adequate quality of food. And 3. An increase in number of shared meals, among many others. These issues comprise the most recent focus of Japanese nutrition policy. Next, we'll introduce 6 major programs under the Health and Nutrition Policy, established in 2000. The first of these programs is the Dietary Guidelines for Japanese, published in 2000. These provide practical daily life targets for health maintenance, health improvement, and disease prevention. These guidelines were created jointly by 3 ministries: the Ministry of Education, Culture, Sports, Science, and Technology, the Ministry of Health, Labor, and Welfare, and the Ministry of Agriculture, Forestry, and Fisheries. The Dietary Guidelines for Japanese, that were revised in 2016, are comprised of 10 items. They include individual-focused guidelines, such as 1. Enjoy your meals, or 4. Eat well-balanced meals with staple food, as well as main and side dishes. And community-focused guidelines, such as 8. Take advantage of Japanese dietary culture and local food products. Preserve local dishes. Or 9. Conserve food resources and practice dietary habits for minimizing leftovers and food waste. The second health and nutrition program is Healthy Parents and Children 21, which was announced in 2001 as part of the third National Health Promotion Measures, also known as Health Japan 21, which began in 2000. This program is a national campaign to facilitate efforts for improving the health level of mothers and children, and sets 4 challenges. The nutrition program is involved in municipal health services for mother and child, in particular, Challenge 2, securing a safe and comfortable pregnancy and delivery, as well as support those with infertility, and Challenge 4, promoting children's healthy mental development and reducing the anxiety around raising children, are addressed through systems that provide prenatal and baby-infant checkups and consultation, complementary feeding classes, and guidance on breastfeeding. The second program was created in 2015 and will continue until 2024. The third health and nutrition program is the Food Guide, which was created in 2005. This guide, produced by the Ministry of Health, Labor, and Welfare, and the Ministry of Agriculture, Forestry, and Fisheries, clearly indicates what and how much to eat during daily meals. The guide is based on the guidelines laid out in the Dietary Guidelines for Japanese and is utilized as a tool for citizens' nutrition education. The food guide indicates what and how much to eat through an illustration of a spinning top. This spinning top creatively portrays a combination of dishes and approximate serving sizes. The fourth health and nutrition program revolves around the Basic Act on Shokuiku, which was created in 2005. In Japan, efforts based on a concept called Shokuiku, dietary education, are underway. Shokuiku focuses on developing the following: a habit of reassessing your diet, appreciation for food, diverse knowledge of food, and a good sense of judgment to choose foods that contribute to a healthy diet. The Basic Act on Shokuiku, enacted in 2005, lays out the national food philosophy and basic policies and enforcement measures. It stipulates that it is the responsibility of national and local government to take necessary measures to improve diet in each region. Meanwhile, for citizens, it indicates that they shall strive to maintain a healthy diet throughout their lives and contribute to the promotion of the Shokuiku concept. In the following year, 2006, the Basic Plan for Shokuiku Promotion was created. This plan is updated every 5 years. This Basic Plan for Shokuiku Promotion serves as the fifth health and nutrition program. This plan was created in 2006, 1 year after the Basic Act on Shokuiku was enacted in 2005. Currently, the third Basic Plan for Shokuiku Promotion is underway. This plan specifies the structure of Shokuiku, which national and local governments are responsible for under the Basic Act on Shokuiku. The main points of the plan are: 1. Shokuiku promotion among younger generations. 2. Shokuiku promotion to cater to diverse lifestyles. 3. Shokuiku promotion in order to increase healthy life expectancy. 4. Shokuiku promotion to appreciate food circulation and environmental consciousness. And 5. Shokuiku promotion in order to learn about traditional cuisine. These promotions also incorporate shokuiku in the areas of health for mothers and children, and general child welfare. The Shokuiku Promotion Plan covers a wide variety of fields and is prepared and implemented by each municipality, utilizing unique regional foods. The sixth Health and Nutrition Program focuses on the system of specific health checkups and specific health guidance, which began in 2008. In recent years, about 60% of Japanese deaths can be attributed to cancer, cerebrovascular disease, or heart disease, stemming from lifestyle-related diseases. In response, the system of specific health checkups and specific health guidance was put in place. This program aims to contribute to disease prevention by reducing those suffering or deemed to potentially suffer from lifestyle-related diseases. Specific health checkups are for people aged 40 to 74 who are enrolled in the health insurance system and includes checks on factors concerning lifestyle-related diseases such as BMI and blood pressure. Under the Japanese Universal Health Insurance System, people have an opportunity to get a checkup once a year with costs subsidized by the government. Specific health guidance supports people with high risk of lifestyle-related diseases by having their lifestyle reviewed by professionals, such as public health nurses or a registered dietitian. This guidance aims to mitigate disease through lifestyle improvements based on the results of patients' specific health checkup. Now, we will introduce the methods Japan currently uses to promote its nutrition policy. Under the guidance of the Ministry of Health, Labor, and Welfare, public health centers established by prefectures, designated cities, central cities, or special wards are responsible for administering nutrition policy. Municipalities of all sizes establish locations such as municipal health centers, regional support centers, and parenting support centers to promote local health measures comprehensively. Public health centers function as broad-based professional and technical bases for local health. They also collaborate with medical institutions with cooperation from local medical associations. Municipal health centers prepare plans for local health, including frequently used services such as health consultation, health guidance, and health checkups, with a goal to provide comprehensive health and welfare services. Nutrition policy is supported mainly by registered dietitians and dietitians. Registered dietitian is a national qualification for those engaged in special nutrition management at medical facilities, nursing homes, and other such institutions, as well as assisting healthy people with their dietary needs. Dietitian is a prefectural qualification for providing nutrition guidance for healthy citizens. In local governments, municipal dietitians and nutrition teachers are assigned to improve the health of local residents and provide guidance on food to students. In this capacity, they also manage the provision of school lunches. All of Japanese nutrition policy can be traced back to national surveys on nutrition. The National Health and Nutrition Survey is based on an original survey conducted in 1945 and has been implemented for more than 75 years with intermittent changes in its goals and legal designation. The survey is implemented every year to ascertain citizens' physical condition, nutritional intake, and lifestyle. This data is then used as the basis for policies to promote overall national health. The National Health and Nutrition Survey is planned by the Ministry of Health, Labor, and Welfare and implemented by public health centers for each region under the authority of prefectural, city, or special ward governments. In 2000, as part of the third National Health Promotion Measures, it was established that all health and nutrition policies and programs shall be based on the results of this survey. In other words, the National Health and Nutrition Survey is conducted as an important step of the management cycle for effective and efficient health policy implementation. The survey enables development of goal-oriented policies focused on setting and evaluating goals using scientific evidence. In these ways, from the post-war programs designed to respond to food shortages and nutritional deficiency to the more modern programs of the present day, Japanese nutrition policy has steadily evolved to meet the needs and challenges of the times. Today, Japanese nutrition policy is designated as one aspect of the national health policy based on the three pillars of diet-focused nutrition policy, nationwide human resource development and deployment, and evidence-based policy making. Based on these guidelines, we continue to implement nutrition policy, covering not only the normal life course from infant to elderly, but also those who face illness or are the victims of natural disasters, all through accessible public health services.